Our next big bony landmark is the sagittal crest. So to palpate this on the canine skull, if you come to the back of the skull, which is also known as the external occipital protuberance, you can lie your finger at that protuberance and begin to slide forward rostrally. You'll be on top of that sagittal crest, and you can appreciate that the sagittal crest, or what feels like a ridge, is going to slightly flatten as you come down the sagittal crest. This is what we're aiming for with our needle for placement. The third area that we'll look at on the skull is the condylar process of the mandible. So we have 2 points that we're palpating for when we palpate for the condylar process. We're trying to find points small intestine 19 and triple heater 21 are dorsal to this condylar process of the mandible. So in palpating for that, you're going to be just in front of the tragus. You'll palpate for a bony structure, and you may even be able to feel the joint line, but you want to palpate for this bony structure just in front of the tragus. Your needles are going to go dorsal to that condylar process. This can also be more easily palpated with the jaw opened. You can open and close that jaw to appreciate this pea-sized bump of the condylar process, and your needles will go dorsal to that condylar process for triple heater 21, most dorsal, and small intestine 19, which is just distal to triple heater 21. Again, dorsal though to the condylar process.